are two main types of diabetes, type 1 and type 2. They're different conditions, but they're both serious. There are some other rarer types of diabetes too. What all types of diabetes have in common is that they cause people to have too much glucose in their blood. But we all need some glucose. It's what gives us our energy. We get glucose when our bodies break down the carbohydrates that we eat or drink, and that glucose is released into our blood. We also need a hormone called insulin. It's made by our pancreas, and it's insulin that allows the glucose in our blood to enter our cells and fuel our bodies. If you don't have diabetes, your pancreas senses when glucose has entered your bloodstream and releases the right amount of insulin so the glucose can get into your cells. But if you have diabetes, this system doesn't work. When you've got type 1 diabetes, you can't make any insulin at all. If you've got type 2 diabetes, it's a bit different. The insulin you make either can't work effectively or you can't produce enough of it. In both types of diabetes, because glucose can't get into your cells, it begins to build up in your blood. And too much glucose in your blood causes a lot of different problems. To begin with, it leads to diabetes symptoms like having to wee a lot, being incredibly thirsty and feeling very tired. You may also lose weight, get infections like thrush, or suffer from slow healing wounds. Over a long period of time, high glucose levels in your blood can seriously damage your heart, your eyes, your feet, and your kidneys. These are known as the complications of diabetes. But with the right treatment and care, people can live a healthy life. And there's much less risk that someone will experience these complications. If you've got diabetes, you can find lots of information and support about living with it using our website and helpline. As well as campaigning for everyone with diabetes to get the right care, Diabetes UK fund research into all types of diabetes so we can develop new treatments and one day find a cure. You can find out more about type 1 diabetes in our next videos.
Type 1 diabetes is a metabolic condition that results in increased blood glucose levels due to a total lack of the hormone insulin. Although type 1 diabetes can occur at all ages, it mostly occurs in children and young adults, with a peak at around preschool and puberty. Type 1 diabetes results from an autoimmune destruction of the islet cells in the pancreas. Beta cells in the islets of Langerhans produce insulin. This may be due to the environment, a virus, or a genetic tendency. Type 1 diabetes is treated by insulin injections.
About 10% of people with diabetes have type 1. It's got nothing to do with diet or lifestyle, it just happens. When you have type 1 diabetes, your body attacks the insulin-producing cells in your pancreas, so you can't produce any insulin at all. And we all need insulin to live. It does an essential job. It allows the glucose in our blood to enter our cells and fuel our bodies. When you have type 1 diabetes, your body still breaks down the carbohydrate from food and drink and turns it into glucose. But when the glucose enters your bloodstream, there's no insulin to allow it into your body's cells. More and more glucose then builds up in your bloodstream. So what does this mean? Well, before diagnosis, your body tries to get rid of the glucose through your kidneys, and that makes you wee a lot. Weeing so much leads to another symptom of diabetes, extreme thirst. Because glucose can't enter your cells to give you energy, you'll feel incredibly tired. To try and get energy, the body breaks down fat stores to provide fuel. That's why people often lose weight before discovering they've got type 1 diabetes. These symptoms tend to come on quickly, over just a few days or weeks. Anyone who has these symptoms should see a doctor as soon as possible. If you've got type 1 diabetes, you get insulin into your body by injecting it or using a pump which delivers a constant supply into you. You'll also need to check that your blood glucose levels are not too low or too high by using a blood glucose testing device several times a day. When you start taking insulin, you'll begin to feel better, and your blood glucose levels will go down. This is important because over a long period of time, high glucose levels in your blood can seriously damage your heart, your eyes, your feet, and your kidneys. These are known as the complications of diabetes. But with the right treatment and care, the long-term effects of diabetes and high glucose levels can be managed. You can find out how we can help you manage your diabetes on our website. We're still not sure why some people get type 1 diabetes and others don't, or why the immune system of someone with type 1 attacks the cells that produce insulin. But our researchers are learning more and more about type 1 diabetes so we can develop new treatments and one day find a cure.
People with type 1 diabetes produce no insulin. Glucose cannot enter the body's cells and the glucose level rises in the blood. The body tries to get rid of this extra glucose by passing more urine, which in turn leads to thirst and dehydration. The cells are starved of glucose, which leads to tiredness, lack of energy and weight loss. As soon as insulin is injected, the cell doors can open and glucose is available for energy. The body needs a constant supply of glucose for fuel or energy. This supply of glucose comes from the food we eat and from stores in the liver. It's mainly the carbohydrate in our food that is broken down into glucose and released into the bloodstream. The glucose cannot enter the cells of the body and be used for energy without insulin. Insulin acts like a key. It unlocks the door of the cells and allows the glucose to enter. Surplus glucose is stored in the liver and muscles as glycogen. Once the liver and muscles are full, the rest is stored as fat. Without insulin, the body begins to use body fat for energy, producing ketones that can be detected in blood and urine. This can lead to diabetic ketoacidosis, or DKA. Signs of DKA are ketones in the blood and urine, abdominal pain, nausea, vomiting, and eventually unconsciousness. If left untreated, DKA can potentially be a fatal illness.